Dear nurses, thank you for taking the time to learn from this educational video about how to teach patients to take care of their vulva wound before being discharged from the hospital. First, I want to quickly talk about anatomy. You will have a handout. Basically, there's the two lips, that's the labia majora and minora. And then here's the anus, here's the urethra where the urine comes out, and here's the clitoris. In a patient who recently undergo surgery, they might have deformity of the vulva wound, and therefore things may not be exactly symmetrical. Here are our toys. So first of all, teach them how to use a squirt bottle. So we use a squirt bottle just like in OB service, and you want to use it to spray the outside of the wound before you go to pee. And that's because that will reduce the burning from the salt in the urine. So the waters, dilute the urine that's sprayed on the skin. And you can spray again after you finish voiding. Okay, that's that. And then let's talk about the sitz bath. Come follow me, I'll teach you how to do that. First of all, it's available at any drugstore or medical supply store, and it comes in a package like that. It could be a pink one, it could be like a yellow one like this one. This, dump it. Because it's for you to refill hot water if you're too lazy to get up, but we're not. So what we're going to do is very simple. At home, you don't put gloves on, but if you're in the hospital, you lift it up. The toilet bowl, it says flan, and so you sit right here. You fill it with warm water. You can fill as high as you want, and then you put the toilet seat back down. And then you're ready to sit on it for your sitz bath. Notice if you have too much water, the water will just go through the holes here and go into the toilet, so it won't overflood your bathroom. Usually for a sitz bath, we recommend doing it for about 10 to 15 minutes. And the water temperature should be warm, but not too hot, not too cold. It's just whatever you feel comfortable. It should be soothing. And if you sit there for a while and you would like to refill with some water, you can just stand up and dump the water and refill more water. Okay, that's the sitz bath. Other items we can use at home to help with promoting wound healing in vulva. One is shower. So shower is really good, hot running water. You can let soap on your upper body or hair and let just the soap kind of run through the wound. That's totally okay. If you happen to have a handheld shower head, you can use a handheld shower head to specifically spray water on the vulva area directly. When you dry, you should use a towel to pet dry. So no rubbing, pet dry. Another trick that I teach patients is use the hair blow dry. So if you part your legs gently, and be careful not to burn yourself, but you can use a blow dry to keep the area nice and dry, and so it's not like moist. Bacteria love moist environment, so that's blow dry. It's very common when you're healing at home to either have yellowish or pink discharge that's normal from your vulva. You may even pop a stitch, especially in the area where you sit on or apply pressure. That's also very common. It's not something of emergency or cause for concern. However, if you have very heavy bleeding or a temperature over 101.5 or very green, foul-smelling discharge, that's not normal, and you should call your doctor's office immediately. Thank you for your time.